Bowel Cancer. Presentation by Julia Wright and Saskia Wright. Let's start by looking at the definition of cancer. Cancer is a disease of the cells in your body. When you have cancer, the cell growth is abnormal and uncontrolled. This leads to the abnormal cells damaging surrounding tissue and even spreading to other parts of the body. With that definition in mind, let's have a closer look at bowel cancer. When we refer to bowel cancer, we are talking about the cancer of the colon or rectum. Bowel cancer most commonly develops as a malignant growth in the large bowel. Usually it develops from smaller growths called polyps. It is important to note, however, that not all polyps grow into cancer. Bowel cancer can affect the body as it narrows and blocks the bowel. It can also cause bleeding within the bowel or the rectum. More advanced cases can spread beyond the bowel and into the rest of the body. Treatment can include removing the polyps during a small procedure called a colonoscopy, and the patient may also require chemotherapy. Please be aware that these symptoms may be experienced by people at some point in their lives. It may not necessarily mean bowel cancer. These symptoms can also be associated with problems such as hemorrhoids or irritable bowel. If you experience any of these symptoms, please consult your healthcare professional. Blood present in bowel movements, a change in bowel habits, bowel movements that are narrower than usual, frequent gas pains, bloating or cramps, persistent abdominal pain, a lump in your stomach or rectum, unexplained lack of energy, and unexplained vomiting or weight loss. Let's look at some facts. Bowel cancer is the second largest cause of cancer deaths in Australia. Australia has one of the highest rates of bowel cancer in the world. 1 in 12 Australians will be diagnosed with bowel cancer before the age of 85. Of the 291 new cases of bowel cancer diagnosed every week, 96 people will die from the disease within 5 years. 75% of people who get bowel cancer do not have a family history of the disease. It can affect anyone, men, women, young and old. If caught in time, 90% of bowel cancer cases can be treated successfully. This highlights the importance of early detection and regular screening. Screening for bowel cancer is simple and can be done at home with a self-testing kit. Between 2003 and 2011, the Australian Burden of Disease study found that 5 diseases resulted in more than 1/3 of the year's deaths. Bowel cancer was one of these diseases. A recent report by the Australian Institute of Health and Welfare shows that the overall burden of disease and injury in Australia has reduced by 10%, yet bowel cancer continues to feature in the top 5 diseases. The report also states 1/3 of the disease burden could be prevented by removing exposure to risk factors such as smoking, obesity, alcohol consumption, physical inactivity, and high blood pressure. There are many factors that can increase risk of bowel cancer, and these include smoking, being inactive, alcohol consumption, obesity, age, family history, inflammatory bowel disease, and poor diet. A lot of these risk factors can be controlled. To reduce risk of bowel cancer, it is important to eat and enjoy plenty of fruit and vegetables, quit smoking, limit processed and red meats, maintain a healthy body weight, stay active and healthy, eat a high fibre diet, limit your alcohol consumption, and stay hydrated. Research shows that bowel cancer is potentially one of the most preventable cancers. We just need to be able to talk about it more openly and ensure the importance of a healthy lifestyle is understood. It is important for people over the age of 50 to undergo screening every 1 to 2 years. Screening is simple and can be done at home with a self-testing kit, which detects small amounts of blood in bowel movements. It can detect blood from precancerous polyps or early-stage bowel cancer. There is a government-funded screening program in place called the National Bowel Cancer Screening Program. The It's Crunch Time campaign promotes participation by sending out screening kits to eligible Australians. The aim is to raise awareness of the major risk of bowel cancer and its prevention through early detection. Please take a moment to view this video. Bowel Cancer Australia is a national charity working to reduce the impact of bowel cancer in our community. Bowel Cancer Australia offers a variety of practical and emotional support options for patients and their families. This includes bowel cancer nurses, patient resources, a guide on what patients should ask their doctors, a peer-to-peer support network, forums, stories, as well as an extensive list of financial support agencies, emotional support agencies, and practical resources to extend knowledge on medical care as well as holistic approaches. Please take a moment to view this video. For further information and support, please visit www.bowelcanceraustralia.org.